So many patients come in with concerns about their abdominal area, and I like to spend the first several minutes of the consultation really drilling down what that concern is, because there are so many ways to look after this area. There are simple ways like non-invasive skin tightening, RF technology, there's cool sculpting to try to melt some of the fat, there's liposuction, and then of course there's the abdominoplasty. The abdominoplasty being really the ultimate, the most effective way to deal with the abdominal area or the core area as a whole. And so we'll spend a couple of minutes right now going through some of that explanation that I give patients about abdominoplasty specifically. I like to do that with photos, and so that I'll do that with you now. And I like to explain to patients that an abdominoplasty really involves three major aspects. Number one, if we go really deep down, we look at the muscles, and you can see that in many patients, the muscles are split in the middle, so-called diastasis recti, and that needs to be repaired, as you can see here in the midline, and we do that with sutures. Moving a little bit more superficially or more out to the front, we see that there's extra fat in the center of the belly, which adds a protrusion to the belly. We can also see that out the sides of the flanks that give a more rounded shape to the midsection of the body. And so ideally, we want to contour those areas by removing some of the extra fat, and that's done with liposuction at the time of the surgery. And so we get this nice shape like this, and of course we get flat tummy in the middle. And then finally, there's removal of any excess hanging or loose skin, which you can see here. And essentially, when we pull everything tight and close everything up, we get rid of that extra skin. So let me show you what that looks like in an actual patient. So this is a good example here. You can see, first of all, in the side view that there's the extra fat and protrusion of the belly. You can see the same thing on the sides with the round flanks. You can see afterwards the belly is flat. And when we look on the anterior view straight on, you see that all of those things we talked about before have been addressed. You see the curvature of the sides of the core. You see this area is flat. There's no loose skin. And you can even make out that maybe those muscles are now straight down the middle as opposed to where they are here, kind of round. So the abdominoplasty, for those reasons, is the ultimate way to address the midsection. It's three parts: addressing the muscles, repairing them when necessary. It's contouring the surrounding fat, both centrally but also onto the sides to give that nice hourglass shape. And then it's removing any of the excess skin with the closure that keeps everything nice and tight and flat when you look from the side. So I hope that clarifies what an abdominoplasty is and what the components of it are. I'm sure there are questions. I would love to answer them. Put them below and I will do my best. Until next time, take care.